Okay, this is a video on medication administration to help you prepare for your checkoff. The first step is always to verify the order. So I see for my patient Jonah Dinerman, date of birth 3/18XX, the physician ordered the patient to get some potassium chloride. So I'm just going to verify the order against the MAR. And this is the point where you can look up the medication if you're not familiar with it. So we know potassium chloride is an electrolyte. A critical assessment would be to know the patient's current potassium level to make sure that it's safe to give. So that would be an assessment to do. Also, typically you want them to eat it with, or take the medication with food. So we'll assess when their breakfast is coming, kind of to see when it's due. So I'm going to go into the room and start by explaining to my patient what I'm doing. So I'm going to pack the room, perform hand hygiene. Hi, good morning. My name is Megan, and I'm going to be your nurse today. Before I begin, can you please tell me your full name and your birthday?
My name is Jonah Dinerman, and I was born on March 18th, XX.
Okay, and I'm just going to verify with your armband. So you said Jonah Dinerman, 3/18XX. Jonah, are you allergic to anything?
No.
Okay, good. Are you having any pain at all right now?
No.
Okay. The physician ordered us to give you some potassium chloride, so I'm going to go get that ready. It's a medication that's an electrolyte. We're giving it to you because your level was a little bit low this morning. Do you have any questions for me about that medicine? Okay, and I see you've already got water here at the bedside. Do you need anything else?
No.
Okay, I'll be right back with your medication.
Okay.
So now I'm going to move over here to do my checks and verify the medication. So my first order, I'm going to pull the medication, and against the MAR, I'm going to verify that I have, for the correct patient, Jonah Dinerman, potassium chloride. She's due to get 20 MEQs orally this morning at 9 a.m. The right reason is because it's an electrolyte and her level was low. So I have the right patient, drug, dose, route, and time. Okay? So now there's really nothing I need to do in terms of calculations. The dose was for 20 MEQs, which is what my medication is. So I'm going to go ahead and do check 2. So I have Jonah Dinerman, potassium chloride, 20 MEQs, due orally, PO, this morning at 9 a.m. And we already talked about the right reason. So now I'm going to go ahead and go into the room so that I can give it to the patient and do my third and final check. I'm going to wash my hands again. Hi, Jonah. I'm back with your medication. I know I just asked you, but could you please verify again your name and your date of birth?
Jonah Dinerman and March 18th, XX.
Okay, wonderful. And you said you had no allergies. Is that correct?
Yes.
Okay. So now with this being my third and final check, I do need to scan the medication. So again, I'm going to, on here, click, scan the patient barcode, and I can scan her ID and verify that it matches. And then next, I'm going to scan the medication. You always want to make sure you're scanning the patient before the medication to ensure that you have the right person. So on DocuCare, you'll click scan the medication, and then I'll take the medicine and scan it. And I verified that it's correct. I click on that I also have the right dose, 20 MEQs, the right route orally, and it's the right time, 9 a.m. Okay? I did the secondary check by asking for the name and date of birth. And then I'll leave this here until after she's taken the medication. Okay, so I'm going to pop out the medication and hand her. She's sitting in an upright position, and had she been laying flat, I would need to reposition, but she's in a great position to take her medication. Go ahead and you can take that. Okay, and here's a little bit of water. Wonderful. Okay, and I'm going to come on over here and complete my documentation and click that I administered it. So it was administered. Okay, Jonah, is there anything else I can do for you?
Nope.
Okay. I'm going to lower your bed to the lowest position and make sure that your side rails are up and that your bed is locked. Here's your call light. Is there anything else I can get for you? Okay. And then the assessment would be, we want to assess that the potassium level is now within normal range. So you'd check, looking for any potassium loss if she has nausea, vomiting, diarrhea. We'd also possibly reassess the labs if the provider ordered us to recheck. And that's it. And then at the end, I'll document, in which I've already completed that she took her medication and did well. And that's it.